minimize the significance of the procedure. I mean, we are talking about literally cutting on the heart in an open heart situation, but fear of the surgery really holds some people back from what they should do in their best interest. Has there ever been a case where somebody didn't make it out of surgery as a result of the procedure?
So we've done close to 250 of these now, and we've had no major complications. Our definition of major complications is no death, no stroke, no heart attack, no significant bleeding where they required a reoperation in the short term, and we haven't had anyone that's needed a reoperation because the bridge wasn't done completely either. Now, this is not to say that there's been some minor issues. The most debilitating ones is we've seen a few cases of what we call Dressler's syndrome, or an inflammation of the sac around the heart or the sac around the lungs, where they get bad inflammation and pain afterwards, or it can collect fluid around the heart or the lungs. Do that. We've had one or two patients that have required a blood transfusion, received a unit of platelets, and we've also had one or two people who's had some healing problems with the breastbone or the skin above that. At very low rates. I think I have trouble completely putting myself in the patient's position, but I think a lot of the concern, the being scared about having cardiac surgery, are the risk of major complications, and it's not zero, but for us they've been very low. And then I think the recovery, right? There's going to be a period of time where you're not going to be able to do what you want to do when you want to do it. And that's tough, and giving up that control. In my mind, I don't want to ever coerce anyone into surgery, but I think if the symptoms are so significant and the patient's driving it, the cost of the surgery is the risk up front and then the time to recovery. And the patients that we've studied, and we think there's a very high likelihood of significant symptomatic improvement, that risk is short, and the recovery period in the big scheme of things is short, and then hopefully we get you back to doing what you were doing before the way you wanted to do it.
Well, and I want to make two comments on that. First, it is the team, and it's the preparation, having gone through the procedure. So much takes place on the back end that if that doesn't build confidence, I don't know what does. And the second part is people are so concerned, and what we hear more than anything is it's the sternotomy part, it's the cutting open part than it is the heart part. And oh boy, it's going to hurt and the pain. And it's your heart we're worried about, not your sternum and the procedure. And I think as they hear this, what you're saying gives them some solace that, okay, maybe not what I want. We're all impatient. We want it yesterday and we want to be done. But to your point, the body takes time to heal.
And we do offer a minimally invasive option as well. So the recovery can be a little bit quicker with that. Sometimes it's actually more painful than the sternotomy. And I certainly understand people's reticence to have their chests cracked open. But I mean, we do this regularly every week with excellent results, and expect people to be back, to 100%, within 2 to 3 months, and really to be 80 or 90% within a month if they have the sternotomy approach, but potentially a little bit quicker with the thoracotomy approach. But again, yes, as the surgeon, it's easy for me to downplay the surgical approach because it's not being done to me. But I'm also able to prioritize the long-term results and not as much on the short-term discomfort, inconvenience, limitations.